3:37 in the afternoon. Rick Dayton Show continuing on right now. We have heard a lot of different talk about what happens if you're vaccinated, if you're not vaccinated. If you're not vaccinated and you end up with coronavirus, then what? Well, in the NFL, it could be a forfeit. If you work for certain companies, it may be that if you get sick, you've got to foot the bill for that because insurance is not going to cover you. And we're going to talk about that right now with our next guest. Joining us in the Disc Institute at Pittsburgh Newsline is Paul Seegert. He is managing partner with a company called PCS, and it is good to have him back on KDKA. Hello, Paul. How are you?
Doing great. How are you today?
I am doing very well. So PCS Advisers, tell us briefly a little bit about what it is that you do.
We work with employers who are, oddly enough, one of the largest providers of health insurance in this country and show them how to navigate the system and not get taken advantage of. Our clients end up paying about half the national average for health care for their people. And we don't do that by putting everybody on a scary high deductible like we're going to talk about today, or narrowing networks or HSA plans that aren't funded and so on. And that keeps us busy more hours than we have.
How often are you hearing about health insurance or health companies, health providers declaring that they were not necessarily going to cover all of COVID treatments? Is it happening more and more?
It's happening a lot. It was at the kind of the height of the pandemic. You had about an 88% chance that you were not going to have to pay any out-of-pocket costs if you were hospitalized for COVID. Now, and the reason why insurers did that is its own interesting story. It wasn't just their good-heartedness. Then, if you fast forward to today, that has fallen below 30, and it'll continue to fall. It's basically getting phased out. So now what we're seeing is that the average consumer, with the way that health plans have evolved in the last 11 years since the Affordable Care Act kicked in, the average consumer can face an out-of-pocket max that could be $7,000, $8,000.
So you're saying that from the midst of the pandemic, it was 88% with no out-of-pocket. Now it's less than 30% that would have no out-of-pocket expense?
That's right. And it's going to fall another 10% here happening right now as we get into October. And then I expect the rest will sunset that policy by the end of the year.
So then,
the reason they did it, go ahead.
No, I was going to say, how much are we asking the individuals to pay? How much do these health insurance companies expect that people will be able to pay?
Well, the insurer is still going to cover their portion of the bill. What these consumers are facing is their portion, their deductible, their copays, their max out-of-pockets. And that risk has grown tremendously. The out-of-pocket costs that an American consumer faces has risen 87% since the Affordable Care Act kicked in. The plans have basically gotten skinnier, and they cover less in terms of the total bill.
Is it a matter of having bigger copays, having more deductibles? And during the midst of the pandemic, when that 88% number that you were talking about, were those just waived, but still in place?
They were waived.
Okay. So,
yeah, they were waived.
It wasn't like your plan changed, right, in the last year. It's just that they waived them and said, we'll cover everybody. Why would they do that?
That's right. It's a great story. So the insurers, part of the Affordable Care Act, they were told there's a medical loss ratio rule. They were told they had to spend, let's just call it 85 cents of every dollar that they collect in premium they have to spend on a claim. They get to keep 15. So we kind of turned them into like public utilities or something. They were in a cost-plus environment. The idea was that it would contain costs. Of course, that obviously didn't happen. So then you had all these insurers in the midst of COVID who weren't spending money to provide a lot of care because everyone was locked up at home. So they had piles of money accumulating, and they were either going to have to give it back or do something with it. So it was a very prudent choice on their part to say they also were facing the likelihood that the federal government would require this of them. So they beat them to the punch, got some good marketing out of it, and said, hey, we'll waive out-of-pocket costs during the pandemic. Since they did it voluntarily, it also gave them the ability to end it voluntarily, which most have done, and the rest will soon follow suit there. Now that they have claims that are returning to a more normal level and they don't have excess cash that they have to use or give back, they don't really have any reason to do it.
So how can we find out
spreadsheet standpoint?
Yeah, how can we find out what our individual health plans have done? I mean, how do we know whether or not we're covered or not covered, whether we have those big copays and deductibles?
Yeah, what you need to do is go to your carrier, your insurance company site. You have a member login. You can log in there and see. There's a number on the back of your card you can call. And unfortunately, most people that pull the card out of their wallet today are now going to find out they are responsible for those bills. There are some things they can do. I tell people all the time, make sure they actually build your insurance. It's unfortunately common. Providers will provide care and they might just bill you and not bill your insurance. So double check that they actually did that. Ask for if you have a big expense, like a hospitalization for COVID, get an itemized bill. See what you're actually being billed for. Unfortunately, it's a pretty high error rate for those. It may be even be a good idea to ask for your medical records so you can cross-reference and make sure it's being done properly. And then also ask that facility if they have a financial assistance program. Most do. And you can get a big discount. I've seen a $1,200 bill reduced to $90 just on one request.
So when you simply say a financial assistance program, simply saying, hey, we're not in a position where we can pay that, can we negotiate? I mean, is that what you're asking them to do?
Exactly right. Exactly right.
Is everything negotiable?
It really is. It really is. And we're in a crazy place in our healthcare system where there's so much waste, so much fat, and unfortunately fraud, waste, and abuse in our system. We're at a place today where if you pull out your insurance card as an example to get an MRI, they're going to bill your plan after discounts, call it an average of $1,800.
Okay.
Yet if you did not pull your insurance card out and you said, hey, what would you charge if I'm a cash payer? The average answer for that's $287. So because you have insurance and you've taken the step and you're responsible, or you work at a good employer where they're providing coverage or whatever, you have the privilege of being charged 6 times what they'd take from a cash payer. Clearly, we're off track with how this whole thing is working right now.
Holy cow, Paul. The things that you have brought up in this conversation are very troubling for those of us who are sort of saying we just assumed that we were covered. And then on top of that, it sounds like it's almost fraudulent behavior that's going on out there too, doesn't it?
Yeah, it really is. And it would be technically if lobbying wasn't so successful.
Yeah.
People ask me all the time, when will this stop? And the answer is when lobbyists are no longer good at what they do.
Remarkable. Paul Seegert, thank you so much for joining us. We always gain a lot of information from you. Managing partner, again, of a company called PCS Advisers. Paul, you're a great source of information. Thanks for being here.
Thanks for having me. Have a great day.
You bet. Paul Seegert is his name here on KDKA.